love running. I love running.
So we're going to talk a little bit about the anatomy of the lower leg today. The front of the lower leg has three muscles. It has the tibialis anterior muscle, which attaches here. Extensor hallucis longus muscle attaches on the end of the big toe. Extensor digitorum longus attaches on the ends of all these small toes. It's interesting to note that there are two footwear features that will begin the shortening process of this muscle group, and it begins very early in life. The first thing that shortens that muscle group is an elevated heel. Once we put an elevated heel on an individual, that relatively causes their toes to be in this position, which is encouraging shortening. The second, perhaps more significant, footwear position that encourages contracture, shortening, and disability of this muscle group is called toe spring. So between heel elevation and toe spring, in most active individuals, we gradually encourage their foot to stay in this position. So that even when they're non-weight bearing, a lot of times I'll examine somebody and their toes will be in this configuration. What's interesting about lower leg pain is it's my belief system that the anterior lower leg muscles need to be balanced out and antagonized by the posterior lower leg muscles. But very few people that I encounter are familiar with the deep three muscles in the lower leg. Those are known as the tibialis posterior, the flexor hallucis longus, which attaches on the very last bone in the toe on the bottom. So the extensor hallucis longus attaches here on the top, the flexor hallucis longus attaches here on the bottom. And then you've got the flexor digitorum longus, which sends tendons to the ends of all the little toe bones. So it's interesting when you look at almost all footwear out there for most Americans, including athletic footwear. We've got the taper, we've got the toe spring, we've got the elevated heel, which favors a shortening of the anterior lower leg muscles, and the heel elevation favors a shortening of the two posterior lower leg muscles, the gastrocnemius and the soleus. The downside of that is, however, those other three deeper flexor muscles basically get into a tug of war with the anterior muscle group. So in order for both sides of the foot and ankle to be in balance, we need the foot to be positioned like nature intended, which is for the heel to be completely level with the whole front of the foot. That way we don't have a shortening of the gastrocnemius and the soleus. So heel elevation is a no-no if we're concerned about lower leg pain. The first thing we want to do is get that individual down to level. Second thing is avoiding the toe spring. The toe spring on footwear, especially when you add it to an elevated heel, is going to encourage a muscular imbalance of the anterior lower leg. So if you want your lower leg to work properly, you need to understand where those muscles attach. Most of them attach on the very last toe bone. And that's why it's so critical that we pay attention to our foot from the ball of the foot out, as opposed to just fixating on the arch of the foot.